Hey, my name is Aubrey. This is going to be our wound checkoff. And before I begin, I'm going to go ahead and check my physician's orders, and then I'm going to perform hand hygiene. So perform hand hygiene. Knock, knock, knock. Hey, my name is Aubrey. I'm going to be your nurse taking care of you. Can you tell me your name and date of birth? Okay, and are you allergic to any medications, latex, adhesives, or antiseptics? No, awesome. Okay, so today I am going to be changing out your wound dressing and applying a new dressing as well. It should only take about 10 to 15 minutes. And before we begin, I'm going to go ahead and provide your privacy. Wash my hands, and then we can start. I would assess my patient for pain. If they are in pain, I would go ahead and medicate them about 30 minutes prior to doing the wound change. All right, and so now I'm gonna go ahead and gather my supplies. So the supplies that I'm gonna need is some bottled saline, tape, some 4x4s, a wound measuring guide, a dressing change table, some sterile gloves, some non-sterile gloves, so some clean gloves, a sterile cotton tip applicator, and a surgical or abdominal pad as well. All right, and I'm gonna go ahead and perform hand hygiene. One last time, are you in any pain? No? Awesome. Okay. And so before I do change out his dressing, I'm going to make sure that he's in the most comfortable position. I'm going to raise the head of the bed and to the table at the working level that's appropriate. And then I'm also going to make sure that either they're laying down or they're sitting and easy access to their wound. Okay. I've also placed my biohazard bag out that's easily accessible for me, and I have my gloves as well. Okay, so I'm going to go ahead and perform hand hygiene, and I'm going to go ahead and put on my gloves. These are just clean gloves, they're not sterile. Okay, so what I'm going to do is I'm going to loosen up the tape. If you have a wound that sticks really hard and you're having a hard time, you can go ahead and put on some normal saline on the wound. So I'm going to go ahead and loosen the edges of the old dressing, and as I'm doing that, I'm stabilizing the skin, so you want to pull in the opposite direction. Pull in the opposite direction. Pull in the opposite direction. Okay, so I'm going to go ahead and remove my dressing from top to bottom, and I'm going to observe the dressing. So I'm looking for any, the color, the consistency, if there's a strange odor to it. I'm also looking at the amount of drainage that came off, and so then I can go ahead and dispose of this into my biohazard bag. And I'm going to go ahead and remove my gloves as well. So after that, then I can wash my hands, and now I'm going to assess the wound, right? So I'm going to look at if I need to obtain a culture, I can do that. I'm going to look at the stage of the wound, the size of the wound, so the length, the width, the depth, if there's any undermining or tunneling, which is sinus tract. And you can use your watch, your face watch, to document the position of the undermining or the tunneling. I'm gonna look if there's any exudate, the pain, if the patient's in any pain, the edges of the wound to see if they're healing correctly, the site and the surrounding skin of the wound, and also if there's any signs of infection, as well as the wound bed itself. Okay? I've assessed the wound. I'm gonna go ahead and perform hand hygiene, and now I'm gonna go ahead and get ready to open up my sterile container and my sterile gloves as well. So I'm gonna open up my sterile kit. And now I'm going to go ahead and open up the drape and remove that appropriately. And I just want to touch the 1-inch borders of this one as well. Okay. All right. And so now I'm going to go ahead and dump off my kit. All right. And now I'm going to go ahead and pour my saline. Some people use the lip method, which is just dumping out a little bit beforehand, but I'm just going to go ahead and pour it in. I'm just holding it over a little bit so there's no splashback. Okay, so now that's done, we're going to go ahead and open up my sterile gloves. And so with the normal saline that I've already poured that in, I'm using that because I'm going to put my sterile 4x4s in there. So that they're ready for the packing and cleaning of the wound. So now I'm going to go ahead and put on my sterile gloves. I'm going to go ahead and pinch the cuff with my dominant hand. I'm going to slip this guy on. And then I'm going to go ahead and I'm going to go and use my second glove. I'm going to slide it under the cuff. I'm making sure that my thumb is out on this one. And you want to go ahead and put it on. So you don't want to adjust your hands before you get your second glove on, but now that they're both on, I can go ahead and adjust them. Okay, so now that I'm ready, I'm going to go ahead and I can touch everything in my kit now. So, put that guy to the side. Okay, so now that's ready. I'm going to take about 4 pieces of gauze, 4x4s, and I'm going to drop them into my kit to get wet. Okay, and now that's done. So what we're gonna do is we're gonna go ahead and use the clean to dirty method, so top to bottom, and we're gonna clean the wound. We're gonna use a moistened 4x4 gauze, and this kit didn't come with any forceps and sterile forceps, so we're just gonna pretend. It came with some scissors, but I'm not gonna use them. I'm gonna pretend that I'm using forceps. And so for this now, I'm gonna go ahead and take my first piece of gauze that's wet, and I'm gonna wring it out a little bit because we don't want any drips. And so, starting from top to bottom, right in the middle, you'll go down, chuck, grab a new one. Again, I would use forceps. Wring it out. Go down from top to bottom on this first side, come out, chuck. One last time. So I'm switching my gauze each time I want to get a new one. Down to bottom. And chuck. Okay, like I said, I've discarded each piece each time because we want to obviously have new ones. I can dispose of them in the biohazard, and now I'm going to go ahead for this, and you can remove your gloves and start a new sterile kit, but my kit came with everything for the wet to dry dressing, so I'm just going to keep my sterile gloves on. I haven't broken sterile field. I haven't turned my back towards my sterile field. My field is at the waist level. It's constantly in my vision. So we're going to go ahead and move on to the next part. So now, like I've already opened up my kit, it has the abdominal pad in it that I can use, and my saline's already filled, and I have one 4x4 left that I can use as well for the packing. All right, so the amount of gauze that I use when I'm packing the wound is just going to depend on the wound itself, if you need more or less. Okay, so I've performed hand hygiene, I have my sterile gloves on, and now I'm going to go ahead one last time. Like I said, I would use forceps, but we're going to pretend. Grab this last one, wring them out, make sure there's no drips. Okay, and so we're gonna lay this guy right on the wound. I'm going to lay it out. I'm placing the gauze in the depression or the crevices of the wound, and like I said, I would use sterile forceps, but I don't have any. And then for the last part, I'm gonna go ahead and just ensure that when I am putting the gauze in the wound, I don't want to push it too hard in and too far in with like a cotton tip applicator or the forceps because of the tunneling and the crevices. So I just want to lightly pack the wound. I don't want to tightly pack the wound. And then I don't want to extend the moist gauze over the extent of the wound as well to the surrounding tissue. So I'm going to go ahead and grab my one last dry pad and cover it. And then my last thing to do is grab my abdominal pad, and I'm going to place this guy directly on top. Okay, and we're going to secure it with some tape. So I'm going to make sure that all four sides are secure. Okay, so now that the new bandage is securely taped on, I can go ahead and dispose of my sterile gloves and dispose them into the biohazard bag. All right, so I've already taken off my sterile gloves, I've disposed them in the proper biohazard bag, and I've put on new clean gloves to clean out my supplies. So we'll go ahead. With this scissors, I'm going to dispose of this in the sharps container, so I'm going to set that aside and put it in the sharps, and we'll clean all this guy up. So we're going to put this in the biohazard bag, take off my gloves, chuck them in the trash, wash my hands. And now with the tape on the dressing, I'm going to go ahead and label it with the date, the time, and my initials. I'm going to thank the patient, and then I'm done.